Hey everyone, today I will be talking about the Canadian healthcare system, particularly how no one understands it, especially American media, and how it's still deeply flawed, but not at all in the ways that it's covered in media. Within political discussions, pretty much everyone pretends that there's one form of public health care and that's it, and you either have it or you don't, and there's no in between. However, there's dozens of approaches to how to handle public health care, and no system between countries is really the same. They all differ in who runs the services, how the government pays, what the government pays, and so on. Nonetheless, all political discussions of adopting healthcare in the United States are revolved around Canada, and there's no real reason other than geographic and cultural proximity. And within these discussions of adopting healthcare, there's a fundamental misunderstanding of Canadian healthcare on both sides of the debate. Reactionaries to healthcare reform generally cite issue with the costs associated with it, wait times, and fears of government control. Costs is perhaps the most commonly cited issue, and it usually comes out of sort of principles of fiscal conservatism and wanting to minimize government budgets, and they believe that particularly public health care would be too expensive on the taxpayer. But there really is no adequate reason for why healthcare costs would rise under a properly formed healthcare system. The facts are that public healthcare reduces the overall and the per capita costs of healthcare, and you end up paying less in tax than you would for private insurance. A full public healthcare system cuts down on the need for medical insurance entirely. So you're cutting out a bunch of middlemen organizations and reducing bureaucratic costs. One large public system is a lot cheaper to run than thousands of private organizations that are all competing against each other. A single public coverage also drastically increases the bargaining power of the public. This allows for better negotiation for lower costs and better services. Publicly funded medical treatments also encourage someone to seek treatment earlier. This allows for conditions like cancer to be caught on earlier. And aside from saving a massive amount of lives, it also drastically reduces the amount of time that is needed for treatments like that. Catching conditions in earlier stages also usually allows for less serious and expensive treatments to be used. When people consult a doctor earlier, they also find out when they've got contagious diseases earlier. This better prepares them to stay home earlier and reduces the transmission, meaning that less people get sick and less people require treatment. All of these elements dramatically reduce healthcare costs on the public as a whole. Wait times are also one of the most parroted concerns, but they show a fundamental misunderstanding of public healthcare. It implies that treatments or necessary surgeries wouldn't be able to be done in time or as soon. Hence that the healthcare is poorer quality and would result in more deaths. In reality, Canadian patients have a much higher survival rate in nearly all potentially fatal conditions. This shows that wait times really aren't a problem for the Canadian healthcare system. I've also had people try to parrot these concerns to me surrounding my bottom surgery, but they're entirely not applicable to my situation. Pretty much all of the wait time for bottom surgery in my province is done because of deliberate bottlenecking. And the actual wait to get in surgery is entirely minimal. I've known people who were booked in for surgery in 1 to 2 months after they got approval, but the approval process took up to 6 years. Even more ironically, is the psychologists behind the approval process are the ones that aren't publicly funded. This means that the publicly funded surgery has virtually no wait time, while the privately funded approval process has a huge, enormous one. The fear of government control as an issue with public health care is a lot less common, but perhaps the most ridiculous of them all. First of all, paying for healthcare has nothing to do with dictating the services remotely. Second of all, governments like America already have full regulatory control over healthcare and entirely dictate how your services are done. So America already has full control of healthcare. They just don't fund it, and funding it would not change anything. I also find the blind praises of Canadian healthcare to be quite concerning for sure. I think I find them most frustrating because they promote a blindness or an ignorance over the actual faults of the healthcare system and how it does need to change. This isn't at all entirely limited to international reports of Canadian healthcare. There's very much a liberal culture in Canada that strongly holds to the idea that our healthcare system is perfect and is what makes our country great, and any criticisms of it are met with a fair bit of hostility. First of all is the belief that Canadian healthcare is free. And everyone knows that they don't mean actually free. They mean free at point of sale or publicly funded. Though the actual problem with this framing is that most services aren't covered. Coverage is pretty much limited to doctor's visits and some services and treatments at the hospital. There's also a lot of related services to these visits that are still charged. This includes doctor's notes, ambulance rides, or getting prescription medication injected by a professional. And most of these charged services are still charged at a very unreasonable rate. Many specialists also aren't covered. For example, I have to see a neurologist for my chronic pain, and none of that's covered. The same goes for any sort of psychological specialists. If you want to see a psychiatrist or a psychologist or even just a counselor, none of that's covered. Dental care isn't included in public health care. My wisdom teeth removal cost me $5,000, I think, and it was more than double my credit limit, so I needed to find someone else to take the purchase for the meantime. General eye care also isn't included. Many physical specialists such as chiropractors, massage therapy, or most physiotherapists aren't included in coverage. Medical testing is largely not covered, so if you've got conditions such as ADHD, autism, or learning disabilities, they cost thousands of dollars and often aren't covered by insurance either. Finally, medicines and prescriptions are not covered remotely by healthcare. This also includes some vaccines that aren't part of national delivery. I personally had to pay out of pocket for an HPV vaccine. The other common argument is that Canadian healthcare represents some form of equality. While it does assist some lower class Canadians in having healthcare more accessible to them, it doesn't begin to cover everything. And because it largely only covers potentially fatal conditions, low-income people continue to have to choose if they're able to afford healthcare and basic treatments. This means that low-income people still don't have equal access to healthcare, and factors such as not being able to afford your own medication compromise one's own mental stability and makes it a lot harder to have any form of economic mobility. They likely are only able to pursue treatment for chronic conditions at a much later stage if at all. This dramatically increases the likelihood that these chronic conditions become disabling and put them out of work. Because the healthcare system largely ignores those with chronic conditions, it means that the Canadian healthcare largely ignores the most medically marginalized people. Those who are most unable to afford their own treatments aren't covered, and they are left to find compensation under private insurance, which is a near impossibility if you've got a pre-existing expensive condition. This is also not to mention that Canadian healthcare systems are still rich with discrimination. Public funding doesn't change how these services operate. There continue to be issues with not recognizing addresses of people who live on reservations, prejudiced remarks, and outright refusal of service. As I've mentioned, this can be an issue for trans people, but a lot of the time it falls on people of color, mainly Indigenous people in Canada. So too do a lot of women struggle in medicalized settings to just have their observations believed. People that are deemed medically obese often struggle to gain respect from doctors as well. It's a common experience for them to have all of their symptoms reduced to being overweight and struggle to get proper testing. Obviously, none of these issues are fixed by funding itself. None of this means that Canada is worse off because of its healthcare. It is statistically better off in nearly every metric. Among all the reasons listed before that healthcare is a benefit, it also provides an incentive for the government to care about the health and individual well-being of its citizens. It incentivizes things such as healthy food subsidies that make eating healthy more affordable. It incentivizes fixing food deserts so people are within reasonable range to get healthy foods. It also incentivizes labor rights, making sure that people work in healthier conditions. This is because improving the conditions and health of the public can be cheaper than the healthcare costs. The big problem is that Canada really doesn't live up to how it likes to portray itself or how others like to think of it. There very obviously needs to be an increase in coverage for public funded healthcare. I think it's also very important to clear up and have an honest picture of these things before having a large discussion of them. Canada is also one of dozens of healthcare systems, and there's many others to base an American healthcare system off of. I hope you all enjoyed this video and that it was informative for you. I had a wonderful time making it for sure, and I'd love to hear your perspective on things in the comments. Particularly, I'd really like to know what your prior conception of Canadian healthcare was and where you stand on it now. I'd also love to have you to follow along if you'd like to see more content like this. I hope you have a great day, and I will talk to you later.